Hello, my name is Christian Simone, and today I am going to be doing my tracheostomy care video for BSN 266. So the supplies I have here with me today are my gloves, my tracheostomy care kit, my normal saline, my hand sanitizer, and my patients. So first, I am going to make sure that I have the healthcare provider's orders and make sure that I have the supplies to match the procedure. Perfect, I do. I'm then going to take all my supplies and head to the patient's room. I'm going to knock on the patient's door first and close the door behind me, providing patient privacy. I'm then going to wash my hands and introduce myself to the patient. Hello, my name is Simone and I will be your nurse today. Can I get started with your name and date of birth, please? I am going to check the patient's wristband while I verbally hear that they're telling me their name and date of birth. Perfect. So today I am going to be doing some tracheostomy care that your doctor ordered. Is that okay with you? Perfect. This should only take me a little while. And do you have any questions before we get started? No. Okay, great. So I am going to make sure that the patient is in a working, their bed is in a working height, as well as make sure that they're in semi-Fowler's position at 30-degree angle. I'm then going to wash my hands again and put on some gloves. I'm going to take their oxygen source out and check their vitals and put a pulse oximeter on their finger. Please let me know if you have any pain by raising your hand. And then I am going to take their soiled linen and throw it away, as well as throw away my gloves. I'm then going to do hand hygiene again and open the tracheostomy kit. I'm going to take my gloves and put them on the side. I'm then going to take my cover and make sure that I am only touching the shiny part. I am then going to remove my tracheostomy kit. I am then going to take my normal saline and apply the solution in the kit. I'm then going to get my gloves. Make sure that I'm only touching the cuff of the glove. Make sure that I'm putting it on my left hand carefully. I'm then going to take 4 fingers and grab the cuff of the right glove. Make sure that I am only using the cuff to place it down. Okay, now that I am sterile, I am going to organize my utensils. I'm going to put all the Q-tips in the trach kit and let them soak. great. I'm going to take my inner cannula and I'm going to take it out. And I'm going to put it in the solution and allow it to soak. I'm then going to take my brush and clean the inner cannula by brushing it. I'm going to let it soak, and then I'm going to grab it again and make sure that it dries. I'm going to place it back in and make sure that it is locked. I am then going to clean the tracheostomy with the Q-tips. I'm going to clean the rectum. I'm going to clean the face. And then I'm going to clean all over, make sure that I'm getting all crust. Then I'm going to take a gauze and I'm going to pat dry. And then this portion is a 2-person. It requires 2 people, but because of this video, we're only going to do 1, just me. I am going to make sure that the the trach is placed securely while I untie and remove the ties. I'm then going to take my tie incorrectly, make sure that it's on. I'm then going to wrap it around. And tie it. Make sure that it is secured correctly and put 2 fingers to make sure that it's not too tight. I am then going to add my trach lining, my clean trach lining. And I'm going to get 4x4 gauze and put it underneath the tie to make sure that the patient has good skin integrity. And I'm going to take a little piece of tape and not tie it to the patient, but tie it to the gauze. And make sure that that is comfortable I'm then going to take all of my supplies and I am going to remove my gloves and do hand hygiene. I'm going to make sure that the patient is comfortable, place them back into a comfortable position. I am going to make sure that they have their call light, and I'm going to do hand hygiene again, make sure that I am all clean, and that is it for this skills video. I'm also going to be doing some documentation and making sure the patient doesn't have any questions, and that's all. Thank you.